symptoms that don't go away after weeks, even months. And now there are special clinics in Boston helping them recover and really find a new normal. Jacqueline Rodriguez was 28 weeks pregnant when she contracted COVID-19 in April of 2020. She ended up at Tufts Medical Center so sick, doctors performed an emergency C-section in the ICU, delivering baby Julian 10 weeks early. We first met her that summer. She was home and ready to move on.
You think, I'm out of the ICU, I'm home, I'm good. And then you realize, wait a minute, okay, things are not like, I'm not the me that I used to be.
Jacqueline struggles with short-term memory loss and brain fog. She had to quit her job, unable to do the work that once came so easily.
I was very, very confused all the time. I was tripping over words a lot, and I was like, whoa, what's going on?
Jacqueline is one of the survivors known as a COVID long hauler, struggling with lasting symptoms for weeks and months. It's unclear how many there are, but these patients experience a range of symptoms. The most common, fatigue, brain fog, and breathing discomfort.
The first part is identifying it and letting the patients know that, yes, this is real.
Dr. Eric Mahoney is a trauma and acute care surgeon at Tufts. He also leads the ICU Recovery Center. It was set up in 2018 to treat patients with long-term issues that develop after critical illness, and now they treat long haulers as well.
And we're actually finding a very high incidence of chronic physical ailments, weakness, a high incidence of anxiety in their patients, and in many patients, actually cognitive impact.
Once a week, Mahoney and his team meet with these patients, including Jacqueline. They follow them for at least 6 months, making referrals, addressing the most pressing concerns, and the COVID-19 vaccines may provide new hope.
We're seeing patients improve over time. It's just everyone's at their own pace.
Dr. Jason Maley leads the Critical Illness and COVID-19 Survivorship Program at Beth Israel Deaconess Medical Center. He says there is potential for symptom improvement after vaccination, but most of their data at this point is anecdotal.
We are seeing some patients feel improvement several weeks after getting their vaccine dose in terms of their long COVID symptoms. Others don't have any change.
In the meantime, patients like Jacqueline Rodriguez try to find a new normal. And on her tough days, she looks at her children, at Julian.
Every time I see him do something new or trying to figure out how to roll or sit up, and I'm like, wow, you are so strong. And I am so grateful that he is here, and I'm here to see him grow.
Well, some of these long COVID patients weren't sick enough to be in the hospital initially, so they might be feeling some of these symptoms and maybe not connecting it with that initial COVID diagnosis. So the recommendation is if you're experiencing anything like this, you have questions, just call your doctor.